Hello to all my support fibromyalgia friends out there. We are in the midweek of our week over here, although it looks like I'm ready for the weekend because the other day on Monday, I was chatting with someone. And then when I closed the call, I said, "Have a wonderful weekend." And I realized it's Monday. Nope, we are in the midweek. So hopefully we can make it through to the end. And if you look forward to the weekends as much as I do, then please share in the comments. So let's get started with our video support fibro friends. I'm Melissa Toller. I'm the executive director of the Support Fibromyalgia Network, and I'm also a board certified functional medicine health coach. Going to try to do these more videos like frequently or come up with a time that works best for you. So I'm still trying to figure that out and play around with the new equipment we have, working through some like video and audio equipment. So it's exciting to try to do this and just communicate and talk with all of you. I love it and interacting. Sometimes I do some fibromyalgia like random chat. Sometimes it'll have specific topics that we're going to promote ahead of time, especially when it comes to sleep. I am diving in much more into sleep, so I'll have some feedback for you coming up as well. But for today's chat, I wanted to kind of dig in and ask this question of people, because it's come up a lot. And we did an Instagram poll recently asking, like, does your doctor understand fibromyalgia, or how do you feel your doctor understands fibromyalgia? And it was split based on and I'm glad it was kind of split. So we're moving in the right direction of what we need to do when it comes to providers understanding fibromyalgia. But about 41% of you said your doctor did understand fibromyalgia, which is awesome. If those of you out there are tuning in, I'd love to hear from you and post how you got to that successful relationship with your provider. How did you find the provider? What discussions did you have in the beginning when it came to your fibromyalgia to get to the point where you really feel like your doctor understands fibromyalgia? And then there was about 53% of the people who filled out the poll said no. So they don't feel that their provider understands fibromyalgia. So we're going to dig into a little bit of tips and advice with that, on just making sure that the communication is open and answering different questions. So I'm seeing some people like tune in. Hello. Oh my goodness. It is Brandy. Brandy, hello. I miss you so much when it comes to these live videos. I'm wishing you so much love and sending you so much love out there, Miss Brandy. I miss you. Hopefully we can connect more soon. Hi, Robin. It's so good to see you. Okay, yes. So we definitely need to do some more videos, Robin, on sleep. But I'm getting I'm dialing in. I'm doing a lot more research on not only sleep hygiene, which I've tried everything for, and we'll get into that, but just like little details of like calming the nervous system, stuff that I kind of ignored because I knew that I tend to ruminate. So it's kind of finding these details of what's keeping you up at night. And we'll get into a little bit with sleep conversation in this discussion, but I want to go really deep into sleep for some of these next videos. And I've even suggested to some of the other advocates out there that we have a sleep roundtable so we can hear collectively from a bunch of advocates what they do to help themselves get better sleep. So if that sounds interesting to you, let me know. So it's definitely going to be a good discussion, and we'll kind of dive into it. So Brandy, you said you got a new doctor, and we haven't touched yet on fibro. And this is kind of an interesting thing because do you bring up fibromyalgia with your doctor at first, or do you wait it out? And, I don't have a good answer for that yet, because some of this discussion you might have to wait and maybe, you dig in and unwind some of the aspects of fibromyalgia. But let's dig in a little bit to this because it keeps coming up. And I do get this as a frequently asked question quite a bit, is when your doctor doesn't necessarily understand. Is it that they don't understand fibromyalgia itself, or are things coming up that's so complex that you kind of have to unwind it with your provider? And when you notice sometimes too, I think in conversations when we're struggling with our provider, sometimes fibromyalgia advocates suggest like firing your provider, but I think it might come out too soon. So it's figuring out the steps that you can work through with your provider first. Obviously, if they're rude or you're just really not feeling it in the discussions, that's where you may need to move to find another provider, especially in primary care, that understands you a little bit better or willing to take the time to discuss things with you too. But sometimes it's limited. I'm going to be honest, you may not hear the answers that you want to hear from this discussion, and it's a work in progress. As an organization, we're working on the bigger picture with medical education, but it's been tough to get doctors onboarded to learn more about fibromyalgia, update them with the latest research, update them with some updated treatments and how to work collectively with allied professionals. So we're working on launching a program like that for Echo. But in the meantime, as an organization, we felt it's super important to get you as much information as you can from a patient's perspective, that you become this empowered patient in your life. And there's going to be a lot of information here and how you work through this. It's not easy, but we're in a transition phase, right? So the providers are starting to catch up. We're starting to move in that direction. But what we're seeing is rheumatologists are now deferring to primary care more often for treatment of fibromyalgia. So we have to catch up that subset of specialty, right? So you can get the treatment there. And I know we're sometimes limited based on insurance. Can we switch providers? Which providers are covered by insurance? And then also, if you're in different areas, you may not have a variety of providers that you can choose from. And even living in Los Angeles County, I have to be honest, I'm going to be straight up honest with you. I have not had a primary care provider for a long time, and I still don't. I'm currently interviewing primary care providers right now to see the best fit, because I'm like all over the place when it comes to what I need, since I know that some of the standard of care does not necessarily work for me. So it looks like I might need more of a naturopathic care provider, but those don't get covered a lot of times. So you're paying out of pocket, but you need someone to kind of coordinate care and understand what primary care physicians, internal medicine physicians can do for you, especially if you've been going to a lot of specialists. And I'm going to sprinkle in a little bit of my story within this so that people maybe find some correlation with what I had to do. Because I had to do this, like, I had to figure this out on my own, because my providers had gotten to a point where they didn't know what else would help at this point from even like a pharmaceutical standpoint. I tried all of the pharmaceutical medications that you could try that were on the FDA approved list to figure out fibromyalgia and then other things. And it was really trial and error. And they got to a point where, it didn't work. So I don't know if they just didn't understand fibromyalgia or maybe know how to help me, because there are things that you can do with your providers that maybe when you unravel fibromyalgia in pieces, they actually can help you with, and it's within scope of practice. So when it comes to this a little bit better, so let's just imagine you're struggling with your provider, your primary care provider, and even your specialists aren't communicating with each other. So at this point, it gets really confusing. So digging into possibly an allied provider that you are working with. So evaluate who's on your healthcare team. So this is a good place to start. Who do you feel comfortable talking to on your healthcare team when it comes to fibromyalgia that can maybe help you sort through or even talk through some other things? For me, it was my mental health care team. I know they're limited in scope of practice, but teaching me how to journal or to document or to empower myself to ask these questions was super important as I was spinning my wheels. But I found some validation from seeing them because they could see that I was actually having reactions. So I had huge histamine reactions that were getting dismissed. But every time I went to go see my therapist, she would start to see like, whoa, like you have a rash all over your body. And, I'm like, yes, this is what I've been trying to relay to my provider. So it was like those little things. And then she had me documented along the way and really focus on documentation, focus on being a better healthcare advocate. She would run through maybe some scenarios where I could bring this up with my provider and the language I could use. So I really used my mental health care team to get me to these points of communicating with my providers. And I think if you have someone on your team, and this could be across the board, maybe it's your mental health care provider, maybe it's a PT. Physical therapists are awesome because they know such a variety of information, and we underestimate them too sometimes on the team. But if you have extra time, if you're going to a physical therapist, maybe ask for some extra time where you can sit down with them and be like, hey, I'm really struggling. My pain is really bad. My sleep, I'm hitting it at a dead end with my primary care physician. Do you mind sitting down with me? Maybe we can go through some notes, brainstorm some ideas together. Maybe they'll have suggestions on how to communicate. Maybe they have another referral resource for you. You never know. but that's how you look at your whole entire healthcare team. Is there someone on your team that you really value, you trust, you can go further a little bit in your conversation? And we also overlook people like our dentists. Now, dentistry is really interesting too. Like, if you really have a good rapport with your dentist and there's different things happening, especially with migraine like headaches, you get a lot of headaches, or you might have some myofascial issues. Like, again, I'm going to sprinkle in a little bit of my own experience because I get these tender points here and they really start to affect the whole neck down, but it's always in my jaw. I notice those things. So even like a dentist might be able to be a good advocate for you in this situation. Be like, this is where I'm seeing them. The having trouble sleeping. I can't sleep at night, my pain, all this stuff. So someone even like that might be something to go to, and you can maybe spend some extra time with them and see how would be the best terminology to talk to other providers. Just brainstorm with them. I mean, doing health coaching, I'm one of those brainstormers. So now I'm the allied professional that you might come to. So if you're working with a dietitian or a health coach, anybody like that in the allied professions that you feel comfortable approaching, please do give them, just talk with them and sit down and have a conversation with them and see what you can do first. Right. So this is just trying to troubleshoot. And I know it takes some time and energy, but it actually might feel good to hear from one of those allied professionals and let them know that you are struggling and you're trying to work through the situation as best as you can and figure out a better way to get through this. And I think that they'll really appreciate that. And we, just looking and listening, if there's nurses in the office or a PA in the office that maybe you feel more comfortable talking to, approach them and see if I can make an appointment and see if there's a better way for me to communicate with the practitioner or the doctor in the office to get what you need. That's where you can slowly be a better healthcare advocate for you rather than just negating, but like working with the resources that you have. It's super important to do that. So that's one aspect. But then the other thing might be to take a look at what your provider can provide for you, like what they can offer within the scope of what they're willing to do to help you get to what you need. And when you unravel fibromyalgia, so I know it's the umbrella term, and sometimes we're hesitant too. When we get to a new provider, should we bring up fibromyalgia or should we let them figure it out themselves? So you might want to have them unravel some of the basics. So let's go through some of those basics. So there might be a fatigue component. How fatigued are you? And really assess this before you go into your session and have them be like, I'm extraordinarily fatigued. Can we make sure we take a look at regular blood chemistry values? Because this is something that gets missed as well. And it can compound the effect of fibromyalgia. And especially if it goes untreated, again, it'll just make this fibromyalgia sensitization like explode. And with pain, fatigue, unrefreshed sleep, if basic blood chemistry panel is not addressed or looked at, you might be missing something that could provide you some relief. So, especially with aspects of fatigue, you want to take a look at any of your iron deficiencies. Are you anemic? Because if you're anemic, that needs to get addressed. So, primary care providers can help you with that. Checking for your vitamin D. Vitamin D, we see a correlation not only with the immune system, but bone health. We've seen different studies on pain degrees. There needs to be more, but they can run blood chemistry panels for you on vitamin D. You can get that looked at. RBC magnesium, so you can look at to see if you're deficient in magnesium. It comes up quite a bit with fibromyalgia, even though we think we're not. Some people respond really well to magnesium with like even help with sleep. If you get those leg cramps at night, so just general pain and relief, like magnesium is an interesting one. And if you actually take the RBC magnesium, you might find out that you might be actually lower on the scale and seeing if supplementing with magnesium would work with you. So that's something that your primary care physician can look at. They can run full thyroid panels for you, which, okay, that is a little tricky sometimes. But again, you're flagging information for yourself. So even looking at TSH levels, are you on a lower end of the scale or are you on the higher end of the scale? And I definitely think that I'll probably have to do individual videos on blood chemistry panels in itself because you can flag different details. And this is where it's empowering you as a patient. And I know It's not necessarily what you may want to hear at this point, but we're in that transition phase. So we got to give you as much information as we can to empower you as patients to know what to note when you read your blood chemistry panels. Because even if you fall in a normal range, you might have to take note if you're at the lower end or the higher end, especially with thyroid. And I see Brandy saying check hormones. Yes. If the primary care physician can go forward and check some hormone levels, it's perfect because you have to gauge of where you're at, and that could be throwing off your system. And then you'll start to notice patterns too. If you're having hormone issues or cycles, you'll notice if it flares up and that's when your pain increases. Definitely note that with your primary care physician and bring it up because there's a lot of overlapping conditions. It gets really confusing, especially when hormones are involved. I know this one way too well, but I saw patterns. I started to map out my cycles and noticed when I was getting histamine flare ups in my stomach, and flare ups in my pain, it was really coordinated to hormones. But how do you fix that? You may have to be referred to a specialist, but at least you can hone that in with your primary care provider. Because there's different things that may be happening too with figuring out, that whole system with digestion and endometriosis or IC. It's complicated in that area. So this is something that you can talk with your provider about that they might be more familiar in before they refer you to a specialist and before you start circling around with trying to figure out, is it GI? Do I go to OBGYN? Like what do I do? These are things that you can hone in with your primary care physician first, and just work through what that's going on. Another area, fatigue or looking at, is fasting glucose. If you are able to, and I've been trying to do this, is getting a continuous glucose monitor. You can see, like, is there any correlation between spikes in your glucose and your pain, or even spikes in your glucose and fatigue? Do you eat food and then need to go take a nap right after? So these are things to start measuring, and that's stuff that they would understand with blood chemistry panels. And if your fasting glucose gets too high, or you're noticing you're more in the hypoglycemic phase, this is where tools in measuring or working with them on those aspects can be helpful as well. Now, again, unwinding fibromyalgia. So, like, fatigue is a component of fibromyalgia, then sleep. So, there are things that your provider can work on with you when it comes to sleep. So, you can say, I am not sleeping well. And you know that that's a component of fibromyalgia, like unrefreshed sleep. So, how can you take this to your provider and have them work with you? So, there's different things you can ask about if you want to do a sleep study or if you yourself need a pulse oximeter. And we've learned a lot about this through this pandemic of just measuring oxygen levels. And if you have an Apple Watch, you can see your sleep, or any of the Fitbit tools you can measure yourself and be like, look, I'm noticing that my oxygen levels are falling while I'm sleeping. I do snore, or maybe you don't snore, but you're bringing these details and, like, okay, can you work with me on sleep and see what happens? And then you can dissect with your provider what's contributing to some of your sleep issues. Is it going to be pain driven? Are you getting glucose spikes at night or glucose drops at night? What are these things that can help? And, if you haven't tried some of the sleep aids, there's different sleep aids if you wanted to go the medication route, or maybe you can ask them if they would do some research on the supplements route and maybe evaluate what supplements you're taking. Now, I'm not anti-medication. If sleep medications do work for you and there's something that you can find in there, maybe that's something to have a discussion with and then work with them to trial and error what may help. I know that some of the sleep medications are now connected to neurodegenerative diseases or progression of that. So take note of that before and examine what works best. But there's also stuff that maybe isn't in the sleep category that sometimes gets prescribed for fibromyalgia, like SSRIs, might help with sleep, and even stuff like anti-inflammatories and muscle relaxants, which this is where catching up the providers, because they're like, oh, inflammation is not involved with fibromyalgia. But we are seeing a larger subset of patients with fibromyalgia who have higher levels of inflammation, which is another blood value that they can help you measure. You can look at your ESR, your SED rate, your CRP. You can see if you have higher levels of inflammation. You can see if you test positive for ANAs and rheumatoid factor. And all of that, like it's just flagging it, right? You may not have a full blown autoimmune condition developing, but you're starting to see those auto antibodies. You're starting to see positive results. Nothing is conclusive yet, but I do want you to just take note of that in your lab, like highlight it if you print stuff out or flag it with those sticky notes there to like come back. And that way you remember to come back as you get another blood test value. Did those change? Are you seeing patterns? Did it get higher? Because it's all going to be cyclical and it's going to change all the time. So this is where it's just being your own healthcare advocate comes in, and it's important to do the work. But this is, I mean, we've already discussed like different ways that your provider can help. So those basic lab chemistry panels are important to run. So don't forget that if it's been a while before you've gotten a physical, just a basic physical, please go back and do that. That's stuff that your primary care physician can do for you, running general blood chemistry panels, checking in with your blood glucose, looking at some of your cholesterol values to see what's going on, especially the triglycerides, the HDL numbers. If you need other insulin testing, it's a good way to figure out what's going on to like balance, right? Because insulin levels make a lot of difference with how you sleep, and especially its connection to cortisol, and cortisol connects with all the other hormones we know with melatonin. So all of these things connect together, and that's where your primary care physician can really help you dial in at least into basic blood chemistry. So you have that result, you have those reports, and you start to just create this documentation, because you're going to need this documentation as you move forward. Either you may find a provider that really gets it and you have this whole body comprehensive look that they can kind of evaluate, but you've already been documenting it from day one. And you're seeing these blood tests and you're addressing some basic issues that might be coming up with the primary care physician. Because I know pain is tricky. Treating pain these days is very, very tricky with providers, and utilizing other tools. And, you can negotiate. I guess it would be negotiation and be like, hey, doc, I'm working on these lifestyle behavior changes over here. But, I'd like to focus on some of these other things that kind of unravel with fibromyalgia. So you're, going back to unrefreshed sleep. What do you need there? CPAP, sleep study, measuring your oxygen level at night. Like what's going on? Do you need to reevaluate your supplements and help with that in order to get better sleep while you work on your sleep hygiene? Fatigue components. Is there any added extra fatigue components to your fibromyalgia that hasn't been addressed? And then of course, pain. One of the interesting questions is finding some of those root cause of pain. Do you have structural issues? Did you have injuries? You have herniated discs. So you might want to even propose to your provider, be like, okay, I have herniated disc, I have back, or I have a, really bad shoulder. Like, how would you approach treating that as opposed to treating fibromyalgia as a whole? Because again, everything starts to get compounded. You have this peripheral injury that might have instigated the central sensitization, which got the fibromyalgia. So with that, you have fibromyalgia. So the spinal cord is now sending all this information to the brain. But from a peripheral perspective, it kind of started potentially by an injury for you. So make sure that that injury is not forgotten. And if that's the thing that's keeping you up at night or having issues with, you can still talk to your doctor about that. And it is tricky with managing chronic pain in this world right now, but there are still things you can address. And if those are back issues or a back injury, and be like, okay, well, can we focus on this? And you have the power to focus their attention, because I think sometimes we're coming in, I need treatment for my fibromyalgia. But if you be like, okay, the worst part of this is what to you? Is it the pain? Would you like to work on sleep? Or is there a fatigue component that you can work on, and seeing what your provider can help you with? Because there is a lot. I just went through a long list, and especially with those blood chemistry panels, getting that stuff ordered, or anything you might need to make your life easier for documentation or abilities, mobility devices under insurance. There's a lot of this stuff because we're trying to keep it affordable. and realistic for anyone. It needs to be accessible, affordable, and just realistic. This is something that can be done. So that's why I just want to have this conversation. If anyone wants to chime in, please do. Okay, I see Robin. Let's go back to the comments here because I know as I was talking, there was a lot going on. I hope there wasn't some audio issues, but I apologize. It's been a little weird with some of the social media. So Robin does agree that a dentist. Okay. So yeah, so that's something that we don't think of, right? If you have a dentist that's really dialed in and understands this, see how it may help. And this is actually interesting with sleep because sometimes you might need a dental guard to help. If you don't need a full CPAP, there's different things that might be going on and a dental guard to help you sleep, but they can dial in some of the aspects of sleep if you notice your mouth is open all the time or you are snoring. Maybe they can do an evaluation for you to help with that and see if there's a connection to improve your sleep because sleep is crucial. We need to talk about more about sleep with fibromyalgia. Providers need to address this up front because sleep is super crucial for just recovery, to help with pain, to help with the immune system, to help with brain fog and fatigue. If you notice how you feel and you're not sleeping well and you notice the difference, I don't know if you can get to a better place of sleep. I'm always amazed if people can just fall asleep. It's a wonderful trait, but I know with fibromyalgia, it's the unrefreshed sleep. And so there's different phases to that. You have to fall asleep, you have to stay asleep, or if you do wake up, you have to go back to sleep. And then the deep, refreshed sleep seems to be the most difficult for many of us to reach. And this is where we're trying to dial it in. So if they have any other ideas, especially from a dentist perspective, for keeping that airway clear, you're getting enough oxygen into your brain system and your whole body. So you're doing a lot more recovery. That is something that we do forget. So I love this conversation with Robin, Brandy, Judy. Hello. Um, and again, Brandy brings a check to hormones. Hormones get dismissed so much too, and especially thyroid conditions, temperature controls for different things when it comes to sleep. So there's so much that you can, like, if you feel like there's a disconnect with your provider, I would encourage some brainstorming, or I would encourage you to unravel the aspects of fibromyalgia to see what you can get from the provider relationship that you might be struggling with. And like I said, if it's just they absolutely don't care, then yeah, that would be a point where you would definitely need to find a provider. But do ask them, notice if they're trying because it's frustrating. We're frustrated. They're frustrated. There's so many things that you could do, and the information on the internet is all not good. So they'll be looking, it's behind. The research is not caught up to the distribution of the information to our providers. So there's a lag, and we've known this from science. There's about a 17-year lag in catching up providers with education. Now, none of us feel like waiting 17 years. That is for sure. I've had fibromyalgia for more than 20 years. I have no interest in waiting 17 more years. And I know many of you out there, I hear you. So we're in a big transition phase. We're pushing really hard. Providers are catching up with different information. They're using technology. More information can come out faster through technology. So it's coming. The resources are coming. More providers are getting educated as more of the experts are getting saturated and burnt out. So we need to create this transition phase for our providers. But in the meantime, that's why giving you, all of you out there, as much information. I know, even if it's a lot, just remember some key takeaways of being your own healthcare advocate when it comes to this. So brainstorming with an allied professional that will sit down with you, and it can be someone else. It can be a mental health care. It can be a physical therapist, nurse, PA, dentist, someone that can, a health coach, someone that can brainstorm and just like flesh out different ideas, ask you different questions. What do you feel is the priority to do? And go with that priority and lead with it and blend it in and make your own plan too. And then there's the aspect of just keeping track of your information. So you're getting the blood test and you may have to dig in and realize, so if you do see something high or do you see something low, and even if it's within the normal range, then you can kind of dial in if it's too low on normal or too high. It's understanding what the blood chemistry panels mean. And again, I'll do some videos on that because I really had to dig into that, and it gave me a good perspective on measured values. So this is what I take to my doctors now and be like, look, I can see the difference even though I was in normal range when I had a lot of symptoms sometimes, but sometimes I'd be like just out of range for inflammation, just out of range. And doctors kind of wrote that off. But when I started to feel better, those values really dropped to the middle. And I see the difference now. So I noticed trends in my blood test panels. And, still doctors be like, okay, that's interesting, but they don't go further. But I find it interesting because I can notice patterns and I can, self tweak that with what I know. And again, it's a lot of information to take on, and I don't expect you guys to all become providers, but I do want you to understand we're still in a transition phase. So if you are interested in more of those videos of how to read blood chemistry panels and how to understand what might be the ones to really take a look at for fibromyalgia or just basic general health, I think that's the thing. We want to avoid compounded situations or compounded conditions that maybe get overlooked when you come in for fibromyalgia specifically. So if the doctor's only focused on fibromyalgia, there might be things that get missed. And anemia could be a big one too for added fatigue and what you see. You really got to look at those iron levels. Make sure everything with your fatigue component. Vitamin D is a big one. I personally feel values of a normal range. Um, are too low. And we've seen with other autoimmune conditions in some of the research that some of these levels need to be higher for you to feel better with vitamin D. That vitamin D of 20 might be even too low, even though you're on a sort of a normal range, and looking at what might be better in like potentially 50s or 60s. And we see this with neurodegenerative diseases as well. They're trying to like figure out what levels of vitamin D might be better. Yes. So the ferritin, you're measuring that aspect and making sure your provider really takes a look at those levels in your blood test, because some people definitely could be anemic, and that creates a lot of problems in your system. When you don't have enough of something, it creates this cascade and really can just increase your fatigue levels and looking at that. But even those spikes in glucose levels might be crashing you out, and figuring that out with your provider too. But even simple cortisol tests to see if you're extremely high in the morning for waking cortisol or extremely low for waking cortisol, those are things that they can run for blood tests and you can ask them. So they may not have to be a fibromyalgia expert, but just rule out basic chemistry panels first of all, and then if they feel like running rheumatoid factors and ANAs, you can get them to do that. And again, if you're showing some positivity, there's a lot of misinformation on what this means and what it doesn't mean, and there's been discussions with providers I've sat on who disagree. But whether or not they disagree, I think it's good that you just maybe highlight it in your notes. That is something to track, because we know that you can progress into autoimmune condition. This could be early onset of autoimmune conditions. So it's still good to see those values, and at least so you don't have to become this you don't have to evaluate all of your blood tests, but we'll dial in some more tests that you might need to just kind of highlight for yourself and see what's happening, see if you notice any patterns with that at all. But I hope that you found this helpful, everyone. I'll definitely. Oh, I'm seeing comments come into a delay. So I love this too. Is journaling symptoms, but don't become okay. Yeah. So this is great. When it comes to all of this, so hard to figure out what's going on with several. Ooh, we're gonna have to do a separate video on that, Robin, is the several conditions all at once. And how do you figure out what is actually being triggered and activated? But this is a complicated conversation to have because it's a system. It's system wide that sort of flares up as opposed and what's going on. And when you start connecting peripheral nervous system with the central nervous system, and then even with we talk about pain sensitization, amplification, You're going in from periphery to spinal cord to brain, and there's a lot that could be going on, and then if you have organ systems like autoantibodies against all of that, what that does in a cycle. Although I did that Karazian Institute, course, and all I'm gonna take his autoimmune one was really fascinating. I feel like I need if anyone out there wants to give me an honorary medical degree, I will take it. Like, I really felt after that course, I really wanted to go to medical school and then go on the road and help everyone out there that I can in this community because that information was so pivotal for chronic pain and fatigue. He has it dialed in and he unraveled it in a great way because it's complicated for fibromyalgia. He talked about CRPS. He talked about ME/CFS. I do want to take his autoimmune course. He's brilliant with autoimmune conditions because he does research behind it too. And I think there's a course going on for him with molecular mimicry and autoimmune conditions. So he's like the guy for he has so many letters after his name we can't even keep track when he's interviewed. And every time I hear an interview from him, I learn something new. And he's the one that addressed, he's like, don't discount the ANA and rheumatoid factor. He said, if you're starting to see that in a patient, he's like, take note of it, come back to it, like measure it again, see when you do another panel. And he said, keep track of that. So he recently said that to pay attention. And when he talks, you pay attention to what he does. And I'll be sure to post a link too. I think he's moved to a podcast format, but he used to do a lot of Facebook lives. And every time it's just like full of information. He's like genius level. I don't know how he keeps track of all this information in his head. It's really incredible. Yeah, when they all cause the same issues compounded together, but this is where you can dial in. And I know Brandy said journaling, trying to figure it out. I mean, I'm a biohacker, so I journal a lot more specifics than most people because it can be overwhelming. But if you can take notes of maybe what you would like to focus on, like what do you feel is the worst aspect? And you might have to dial this in when it's not just pain. So is there a part of your body that's in more pain? Or maybe there's pain, you're getting a lot of pain, but you're really noticing that your headaches are out of control, or you're finding a specific area, like you're getting a lot of stomach pain. And then you can dial that in specifically to your goal. So that becomes okay, that becomes a priority area and helps you kind of focus out. So, if you're getting a lot of headaches and that's driving a lot of pain, it's not just pain, but you can dial into, okay, I'm having a lot of headaches. Am I noticing then some triggers? So you might start journaling regarding just headaches alone. Can you pick up on any triggers? Are there times of days you're noticing your headaches? Like what works with your headaches? So that way it's not as broad as like I'm just in pain. And I know it's difficult for full body pain, but there's certain things you might or sleep or you notice all this stuff. So what can help? But it might be taking one thing at a time and seeing how you can kind of address those root causes of that because something is happening. And I get headaches from the myofascial pain. Like I said, there's a point in my jaw that really flares up, and I had my boyfriend press on it. You can feel it move, but it creates this whole headache. And then it starts to go down my neck, and I get all that shoulder pain. It's so but I had to dial that in, taking one thing. So it really is just what's your goal and how to figure, but I know sometimes you might just need to be like, "To heck with it. I need to just rest. I'm gonna, like, binge watch TV, and I'm just gonna rest, and I need a break." And that's perfect too, because rest and relaxation is all part of it. We definitely need more rest and relaxation as much as possible. So if you need to tune out and you'd be like, "Okay, for right now, I don't care about my blood test values. The doctor doesn't." I'm like, I'm going to go binge watch my favorite show, maybe hang out with your favorite pet, give some belly rubs and be like, okay, I'm cool for a while too. That's okay as well. So, thank you, everyone. I appreciate it. I'll be back in with more live videos with specific topics because we have things coming up. I do have a new sleep device I'm trying, so I want to do an unboxing for you. It's actually kind of helping. So I'm recognizing that I'm probably way too vigilant of a person. So we'll get into some of that, like sleep. We got to dial in more on nutrition. I'll have updates from ACR right now. We've teamed up with More Than Lupus and Looms for Lupus. We have a booth at the ACR Convergence Conference. It's kind of cool. I love it as an introvert. Online networking is the bomb because you can like leave your card virtually at someone's booth. You can leave them a note whenever you feel like it and you're not in person. So I might be getting so used to this online virtual thing. But there's a More Than Lupus booth that we're a part of, and I appreciate Kelly and for inviting us to be a part of it. So we are there. If you are an advocate attending the ACR Convergence, be sure to drop by. But if you want updates from them, I'll be happy to get some updates. There's some cool poster sessions, a little bit of conversation of fibromyalgia, a little bit of conversation of chronic pain. Is much more with autoimmune conditions. So I can give you guys some summary of what I learned on specific topics that I'm excited about. But thank you so much for tuning in. I am Melissa Tolwer. I'm the executive director of the Support Fibromyalgia Network, and I'm a board certified functional medicine health coach. Please like and share these videos with other fibromyalgia warriors out there. And if you have ideas for videos, I would love to hear from you. Thank you, everyone. Bye.